Hi everyone, my name's Kiran and I'm one of the Menlo Park vloggers. I'll be keeping you all updated with my thoughts and experiences over the coming months. I've got a question that I'm going to answer now, but do make sure to follow Menlo Park Recruitment on LinkedIn, Facebook and Twitter and YouTube so you don't miss any of my videos. If you have any questions for me, pop them in the comments below and we'll make sure to answer these on the next vlog. So today I'm going to be sharing some information on my learnings about the concept of powerlessness and inevitability. So the question I really want to address and talk through is, how do GP trainees deal with the concept of powerlessness and inevitability? So what do we mean by that? So I'm going to start by talking about a case that I recently encountered where I really felt those feelings. So I had a young man, he was around the age of 21, whose presenting complaint on the on-call list was dizziness, and realised quite quickly that was a ticket of entry to talk about what he really wanted to talk about, which was low mood, low energy, and symptoms of depression. So I asked him to come in for a face-to-face. We explored that further, and it turned out that not only was he depressed and at high risk of suicide, the reason for this was that he was unfortunately suffering domestic abuse at the hands of his wife. So obviously a lot to handle in one consultation and a busy on call. So I went through the standard process that one should do, thought about the most risky things to him, so suicide risk and risk of being killed by his partner. I spoke to the psychiatric team the same day, and I ensured that the police had been appropriately involved, as they should be. And all that was fine. And then obviously the psychiatric team said, well, a lot of this is external circumstances that we're not going to particularly be able to help with, which is reasonable enough. And the police had been involved and had told him to try and leave the situation. But because of his financial situation, it would have been very difficult for him to do so. So I was left with this feeling of powerlessness and the idea that I'd done everything within my power to try and help this patient. But there was still a huge number of things outside of my control that may ultimately lead to his death or to further suffering from him. And the idea of inevitability is something that I've heard a lot of GPs talk about. I did some research, some qualitative research around suicide in primary care. And one of the big things that came out was this idea that GPs often feel that suicides, if they're going to happen, are inevitable and that there's nothing anyone can do to stop them or to have predicted them. My feeling is that that's likely a coping strategy that we all use when we feel we've done everything we can, and to then absolve ourselves of potential guilt and responsibility. And that's completely understandable, and that's something that I'm sure we all do. However, I think it's important not to use that as a shortcut to not doing everything you can within your power at the time that you have. So I think one way of tackling this idea of inevitability is to recognize that we can do quite a lot as our role as professionals, whether that even is just being doctor as professional, building a therapeutic alliance with that patient. And the feeling of powerlessness is something I'm sure I will struggle with throughout my career, and I'm sure all of us will. The idea that actually there are a lot of social, political, economic factors that are well outside of our control as singular doctors. However, as long as we can do the best that we can within the zone of our competence, and as long as we can not use the idea of all these other things around suicide as an excuse not to do that, I think that will be good for ourselves in terms of our well-being and the well-being of our patients. So what advice would I give to other GP trainees? It would be to make sure you obviously know the basic stuff, i.e. the science, the risk factors around things like suicide. Appreciate the biopsychosocial model because it is key, but ensure that powerlessness and the idea of inevitability isn't used as a shortcut coping strategy when there are actually things we can do and still go home and sleep at night. Thanks very much for your time. I hope this was a useful reflection.